In terms of what we're seeing in the sort of landscape, the landscape of provision in the workplace, a few things really. A really important awareness, I suppose, a shift in awareness to the importance of prevention. So not just bringing in counselling, psychotherapy, coaching, therapeutic coaching, that is, into workplaces in response to problems that have occurred either through, a variety of reasons in workplaces. There's much more awareness about the need to implement, a variety of support measures for prevention as well to help ensure that workers are happy, supported, productive in the workplace. And I think that's something that's playing out nationally as well in the language of the government policy around mental health. That it's about coming out of primary care, less about that sort of interventionist approach, and it's more about prevention. Prevention's at the heart of it. So it's about going down river really, and stopping people falling in and getting into difficulty. Of course, people will still require that sort of that specialist intervention, that specialist support. But if you've worked to build in the resilience of your people and your organization through good, preventative measures, it's much easier to do that. Another big shift is the recognition that EAPs, can't provide that one-stop shop. They just can't do that. They've been overwhelmed with demand, both in terms of the volume of referrals they're seeing, but also the complexity of cases as well. And EAPs just weren't really set up for that. The sort of 6 to 12 session model of counselling in EAPs is really being stretched and challenged by people with multiple complex needs in the workplace. And we can look at a variety of reasons for that. There's the post-pandemic fallout, the legacy impacts of the pandemic are still very much with us in terms of their impact on physical health, long COVID, and mental health at the same time. And the way it's exacerbated existing conditions with some people. And then we've got the cost of living crisis as well, which is causing considerable strain for many people who are struggling to balance finances alongside their physical, mental, social, financial well-being. So there's a range of things that are happening that have put more pressure on services, and they're struggling to cope in many cases. What that means for employers is that increasingly they need to provide more specialist, nuanced support as part of that wider support package. So for many people, the sort of standard EAP offer will be perfectly acceptable, it will work. But for more and more people, that won't be the case. And it might be that, we need to contract or employers need to contract, differently. They might need to bring in specialist providers. And we've seen a big increase in trauma-informed services, for example. Now, one time you may have seen or you may have associated trauma in the workplace with occupations like, emergency responders and blue light services, because they typically tend to be involved in crisis level, work interventions, or people, working in, situations where they're faced with things that are particularly difficult to contend with. But actually, we've seen certainly over the last sort of 5 years, and since COVID, these things have either been accelerated or they've come to light more, perhaps. Is across professions we're seeing more and more need for trauma-informed therapy. So if you look at the retail sector, for example, the British Retail Consortium released a report a year or so ago which showed an increase in verbal and physical aggression towards shop staff subsequently we've seen, policy come in that makes physical aggression and aggression towards retail staff a specific offence in itself. And alongside that, we've seen increase in theft and other things that have really challenged retail sector workers, and yeah, as a result, we're seeing more organisations, more retail organisations investing in trauma-informed counselling services. And this is true across a number of different industries, I think, that have all been impacted by the pandemic in different ways. You've got people who are now expected to pay, 2-3 times as much for services, for products than they would at one time. There's a lack of availability quite often, and people's expectations aren't met in terms of service, because quite often employers may be recruiting or employing less people, and people who left the workforce perhaps during COVID didn't return, or simply through cost-saving measures because of the cost of living crisis. So that's created this perfect storm, if you like, of people who are unhappy with the service they're getting. They feel they're paying too much for things, and they're bringing those frustrations and taking them out, for want of a better expression, on those frontline staff. So we've seen that. We've seen an increase in a need for trauma-informed services, and we've seen that in the rail industry. We've seen that in retail, the public sector, right across the piece. And these are, these are people who aren't paid, to be in those situations. They're now undertaking conflict resolution training, alongside, the sort of thing you'd expect people in retail, for example, to be training in customer service and things like that. So it gives you an idea of the changing landscape. On top of those issues that I outlined, the cost of living crisis, and the sort of post-pandemic legacy impacts, you've also got war, climate anxiety, political upheaval and change, lots of division, I think, as well, in the sort of social space in particular. So these are difficult times for people, and we're seeing that manifest in businesses. So they're just a few of the key things. We're also seeing a shift towards more digital, generative AI-based services as well. There's been a huge amount of those coming into the space, which again, that implies change for organizations, for therapists working as workplace counselors as well, and need to think about, how they differentiate and, the change in service offer, because, they're very attractive to employers because they tend to be lower cost, and perhaps to a degree more flexible, but not necessarily really as suitable across a whole range of issues that an individual in an organization might be facing. So to an extent, that's a challenge as well as an opportunity for for the counselling, the workplace counselling sector. But yeah, it's certainly an interesting time. We've seen the government launch another consultation on what workforces and what employers would like to see from the government, and there's a real sense of an opportunity here to better connect employers with traditional the sort of public sector services, and to contribute to that broader piece, which is about helping the economy grow and to help society move forward. So yeah, there's been a lot of change in a very short space of time, and I think employers, workforces, to their credit, have really stepped up. So that's been positive to see as well. We've gone past, to an extent, having to pound on doors and promote the message of the importance of health and well-being at work. I think far more organizations get it now. They understand it. For many, the challenge will still be, but how do we afford this? How do we pay for this?